A very good morning, dear students. In the lesson Infectious Diseases and How to Prevent Them, today let us proceed to learn about how we can prevent certain infectious diseases. First, look at the picture here. Do you know what it is? Yes, it is nothing but the waterworks. You have learnt in the previous chapter that the water is purified at the water works which has to be supplied for domestic use. Correct? So this is waterworks wherein the water is purified. Therefore, it is necessary for to prevent certain diseases which are spreading through water should be purified. The water should be purified at the waterworks so that all the germs will be killed. At waterworks, chlorination is one of the process wherein microorganisms are killed. Fine. So, at the village level or in small towns and villages, what is done to kill the microorganisms or destroy the microorganisms in the water? Yes, bleaching powder is added to the community sources of water like water from the well, tube well, bore well. Okay, so bleaching powder is added in order to kill the microorganisms and make the water safe for drinking. And at domestic level, that means in the house and all. Okay, people are advised to drink boiled water. That means boiling is very important to kill the microorganism. So when the water is sent in a larger amount from the waterworks, already at the waterworks the different stages are there wherein the water is getting purified. First settling and all, you have learned that previously, right? And final step is chlorination, wherein all the microorganisms are killed. In the community, in the towns and villages, bleaching powder is added to the community sources of water, whereas when we are drinking at home, we need to boil the water before drinking it. Correct? So as to avoid germs of the epidemic of gastro or jaundice maybe. Fine. Then let us see how we can prevent the mosquitoes from breeding. Okay, do you know what is this picture? Yes, it is the picture wherein it is shown that mosquitoes are breeding inside or they are reproducing there. So, how can we prevent these mosquitoes from breeding? Okay, so to prevent mosquitoes from breeding, we must ensure that there is no stagnant water. There is no stagnant water in the surrounding. Now what is that stagnant water means? Stagnant water means nothing but the water which gets collected for a long time and which gives bad smell, okay, or which looks dirty. So that type of water mosquitoes like for their reproduction, and that reproduction only is called as breeding. Reproduction means nothing but giving rise to more number of mosquitoes. That is called as reproduction, also called as breeding. Okay, so in order to stop diseases which are caused by mosquito like malaria or dengue maybe or chikungunya, elephantiasis, all these are caused by different types of mosquitoes. And if we want to prevent all these diseases from getting, okay, then we have to prevent the breeding of the mosquitoes itself. And where mosquitoes are breeding, they are breeding in the stagnant water. Fine. So if it is not possible, then what can we do? So if it is not possible to prevent these mosquitoes which have already grown in a larger number, they have already reproduced themselves in the stagnant water, and then what we can do is that insecticides will be sprayed on the different places, and once insecticides are sprayed, this mosquitoes which are in the form of larvae or maybe pupa or maybe sometimes mosquitoes also, once they are formed, are getting killed by spraying of the insecticides. But it is better to prevent them. How we can prevent them? Just do not keep any vessel open outside so that the water can get collected, especially during the rainy season, or even afterwards also. Never keep any vessel which is filled with water. Okay, after some time you will find that the mosquito larvae have been produced in those in that stagnant water. Fine. So this is one of the preventive measure for diseases caused by mosquitoes like malaria, dengue and all. Fine. For you have to remember at least one name of the disease that you can remember is malaria. Fine. So now which are the diseases which we can get? You can get diseases like tuberculosis and all. So tuberculosis or swine flu, which are very dreadful and they spread through air. Then what can be done with this such patient? Such patients needs to be quarantined. Quarantine means, now you know what is quarantine. Quarantine means to keep them away from others, so that whatever the spread will be there of the disease through the air will not spread for so many people. That is why quarantine should be there for such patients. And nowadays COVID-19 patients also, if they are found, then they are quarantined or they are kept separate, so that disease does not spread to other people. Okay, so such people who are having infectious diseases like tuberculosis or swine flu are quarantined or they are kept separately from the other people. Even now you remember COVID-19. Okay, and there are separate wards in the hospital for people with such infectious diseases. Okay, so clothes and utensils used by the patients are also washed with the germicides, because their clothes also, when they sneeze or cough, okay, what happens is that those germs also fall on their clothes. So then even through clothes it can spread, because if anyone touches those clothes, used clothes of the patients and all, they can also the germs will be on their hand. So those patients' clothes also needs to be washed regularly with the germicides. Okay, so they need to be germicide, they have to be killed. Or what else can be done with such patients? Nothing but if they are spitting, okay, especially tuberculosis patient and all, they need to throw the spittle out. Okay, spittle means the spit. They have to throw out. How they can throw out? They cannot simply throw out anywhere in the public places. For them they require a special vessel, and that vessel is actually called as a spittoon, wherein the patient will be throwing the spittle in that vessel. Okay, especially the tuberculosis patient, because it can through the droplets of the spittle also it can spread. That is why whenever they are throwing the spittle, they cannot throw the spittle anywhere. They have to throw in a special vessel called as spittoon. Okay, so in this, when it is getting collected, it can be killed with the help of a germicide like that of a phenyl. Okay, phenyl is a very effective chemical which can kill the germicides. Therefore, in the toilets and all, phenyl is used. You might have heard about it, right? Fine. Then such precautions help to prevent the disease from spreading to others. Okay, so it will not spread. Like for example, first of all, they should be quarantined. Second thing, their clothes should be washed with the germicides. And third thing, if they want to spit, okay, their spittle should be collected in a vessel. Okay, and that vessel should be germicide should be added to this type of vessel, so that in the spittoon, when they are collected, they will be killed due to germicide. Germicide are the chemicals which are used to kill the germs, so they are called as germicide. Fine. So now let's proceed further with other preventive measures, like other diseases which are spread through air. So if certain diseases which are spread through air, that means due to coughing or maybe through sneezing, okay, such people should always cover their mouth. When they are sneezing or coughing, they should cover their mouth and avoid spitting in the open spaces. Fine. And it is also necessary to be never avoid spitting in the public places, so that through the spittle it does not enter into the air. Fine. Then also if it is necessary to be with such patients all the time, then the other person should wear a mask. You see doctors, so many doctors always wearing a mask when they are handling these type of patient. Okay, fine. So now let's continue with the next part. If someone in the family gets the disease, infectious disease, the government health department should be informed so that necessary steps can be taken for preventing the spread of the disease. Fine. So health department should be mentioned if anyone is having any of the infectious disease. Okay. So this is regarding how we can prevent the infectious disease. There are other methods also of the prevention. So let's proceed with the next part of the lesson. Now look at this picture here, students. Okay, and answer the question here. When there is an epidemic of a disease, does every person in the area get the disease? Now you have learned what is an epidemic. Epidemic means it's a disease which is spread at the same time in the same locality, and many people are getting affected at the same time. So that is called an epidemic of a disease. Now like that, suppose there is an epidemic of a malaria or something, some other like cholera and all. Do you think so that all the people are getting the same disease at the same time? Now, many people are getting, but do all the people get? No, my dear students. All may not suffer from a particular infectious disease. It's because our body has a system called as immunity system, wherein the body tries to fight against so many microorganisms which enter in our body. And that is nothing but our cells called as white blood cells. We have red blood cells carrying red blood and white blood cells which are actually acting like the soldier cells of our body. Okay, so when any microorganism enter in our body, these soldier cells will be always fighting against the germs or the microorganisms which enter, and therefore so many of the infectious diseases we can prevent or can be prevented due to our immunity system. Fine. So that is only called as the disease resistance capacity of the body. So when disease producing microorganism enter our body, the body resists the disease or fights the germs. Okay, so that means not all the people will get the epidemic, okay, of a disease. Then that is why many people or many times we do not get a disease even if the germs enter our body. So that you should remember. So all the time so many microorganisms must be entering in our body. That means we should be all the time sick. Correct? But that does not happen. It's because our body is able to fight against the disease causing microorganism. And the second way is, another way to prevent a disease is by vaccination. Okay, vaccination. So our body develops resistance to a particular disease due to vaccination. That means artificial immunization, when it is done, that is called as vaccination. That means vaccine can be given by injection or polio dose, like it is given orally. So like that, vaccines also can be given into a body, and then once the vaccine is given, body develops the resistance against that particular disease of which the vaccine is given. Now for example, COVID-19, you know that nowadays people, scientists are trying to get the vaccine, and one vaccine has already come also in India, and health workers are first given the vaccine, correct, and then later on it will be given to common people also, so as to fight against the virus or coronavirus. So that vaccine is for fighting against the disease of COVID-19. Fine, that is to kill the virus of corona or coronavirus. Fine. So like that, many vaccines are given. For example, tetanus, whooping cough, polio, diphtheria. These different vaccines are given. So even for tuberculosis, when a baby is born, that time tuberculosis vaccine is given. So but before that, you just see here a picture I have placed, where in one round shaped structure is shown to fight against so many germs. That is nothing but the white blood cells, which has the ability ability to fight against so many germs. So you can see how our immunity fight inside our body. It's not like it's a cartoon shown here, but the cells of our body are able to fight against diseases. And second thing, as I mentioned to you, vaccination can also prevent so many diseases against which the vaccine is given of that particular disease. Now let's see, when a baby is born, okay, within 24 hours, a baby is given a vaccine called as tuberculosis vaccine. Okay, and that vaccine, the name of the vaccine is also called as BCG vaccine. Fine. So that is given when the baby is born. That means the baby should be able to fight against the germs of the tuberculosis. That vaccine is called as BCG. Not only BCG vaccine, when this is given within 24 hours, that means when the baby is born, but even after 1.5 months, there are different vaccines given. Like for example, one is triple vaccine, second is polio vaccine. Now triple vaccine consists of, triple means 3, okay, a vaccine which consists of immunization for 3 different diseases. That is, one is diphtheria, second whooping cough and tetanus. Okay, whooping cough, tetanus and diphtheria, these 3 are there combined in a one vaccine, and that vaccine is also called a triple vaccine. Second one is polio vaccine. This vaccine is given when the baby is almost 1.5 month old. Okay, and the same vaccines again, they are repeated 2 times again after the interval of 1 month. That means if first one is given by 1.5 month, second will be given 2.5 month, third will be given at the interval of 3.5 month. That means 1 month difference is there. So 1.5 month, 2.5 month, 3.5 months. It is given triple vaccine and polio. And when the baby is born, BCG vaccine is given for tuberculosis disease. Fine. Now, why are these vaccines given? Like for example, diphtheria. Why diphtheria it is given? Diphtheria is a dreadful disease which causes, mostly it is a respiratory disease which causes sore throat, wherein the person cannot, swallow anything. Fine, there is difficulty in breathing, difficulty, there will be coughing all the time, and even, a sore throat layer is formed above the throat. Okay, and because of that, a person is unable to breathe properly, unable to eat properly. That is diphtheria. Second is whooping cough. The name itself is telling you whooping cough means what? The cough which is continuous, and prolonged, and it gives a sound called whooping. In Marathi, it is also called a dangya khokla. Means the person, coughs so loudly, that sound of the coughing is also called whooping. Fine. So that is why this disease also, cannot be cured later on. That is why vaccine is given to resist this disease. Fine. Then next is tetanus. Tetanus is also very dreadful disease. Tetanus injection, you might have heard that we are supposed to take a tetanus vaccine or injection whenever you get a cut, or maybe any iron nail have pierced your skin or so. Correct. Then if dog has bitten you or whatever it is, correct. So whenever there is a wound, there are chances that bacterium called as Clostridium tetani may enter in your body, and that causes a disease called as tetanus. Now that tetanus, why is so we have to get scared of this? It's because tetanus is such a disease wherein it causes contraction of the muscles. It causes what? Contraction, means the muscles contract like this, okay, and it is hard for them to relax like this. For example, if it mostly takes place in the facial part, or maybe the neck part or the chest, what can happen is that when a person, not chest, backbone. So when it is facial, when the person cannot open their mouth like this, it will be in a condition like this, for like this, they will be stretching like this, the muscles contract like this, and they cannot relax. Relax means like how I am opening my mouth, they cannot open it, will remain like this only for a long time, and which causes these persons to not eat properly or swallow anything or drink anything. So contraction of the muscles taking place and the muscles do not relax here. This is one thing. Of the neck also, tightening of the neck it becomes, and the person cannot breathe properly or move the neck and all. When the backbone suppose it is arrested, then the person will be like this in this position, and even if there might be even fractures also when the person is like this. Fine. So tetanus is also very dreadful disease, and therefore we need to get immunized, or we need to take vaccine against these diseases, okay, which are very dangerous. And of course polio, you have seen so many polio patients that they have thin limbs, and they cannot they are paralyzed their entire life. So that means there is no cure for polio also. So that is why it is better to get prevented instead of getting cured. So there is no cure for these diseases, okay, there is no cure for these diseases. It's therefore prevention through vaccination is always good. And therefore a baby, when he or she is 1.5 month old, then again 2.5 month old and 3.5 month old, when they are given these vaccines. So diphtheria vaccine, and the you can see how diphtheria or triple vaccine is given. It is given in the form of a injection. So you can see how it is given. In the case of diphtheria, whooping cough, and the tetanus are combined into a triple vaccine, and it is given as an injection. Whereas if you see your polio vaccine, it is given orally. That means you might have seen your younger ones now. If you have a brother or a sister, you might have seen that the polio vaccine is given in the form of drops. So Amitabh Bachchan's ad also you might have seen, Mr. Amitabh Bachchan's ad, that he says that do boon zindagi ke. That means 2 drops only of the polio if you take, you are getting immunized against polio disease. Fine. So this is regarding the prevention of so many diseases. Now we have learned how we can prevent certain diseases, and of course even though the germs enter in our body is always ready to fight against certain diseases. But there are certain diseases which we cannot prevent, which we cannot control, like that of the polio or diphtheria, whooping cough and all, tetanus. Fine. All these diseases needs to be immunized, and for that what we require is artificial immunization through vaccines, by giving through as injection in the form of a triple vaccine, that is of the whooping cough, tetanus and what is that, diphtheria. Okay, these 3 combined in one injection, and your polio vaccine is given in the form of oral dose. So this is regarding the prevention of the diseases, infectious diseases. So next time we are going to learn about what are the public health service facilities in the next video. So till then students, bye and thank you.